HBOT, yet another feather in Oxymed's cap. Located in Nandanam, Chennai, is Oxymed Hospitals, a unique healthcare institution that focuses on state-of-the-art, non-invasive, non-surgical methods of treatment of illnesses. Having succeeded in successfully rehabilitating over 10,000 cardiac patients with non-surgical treatment, Dr. Ayaz Akbar, the founder and managing director of the hospital, decided to extend non-invasive treatment to ortho-related conditions such as osteoarthritis by deploying the following forms of therapy: emitron, laser, physiotherapy, reflexology, detoxification using chelation and prolo injection therapy. Non-invasive treatment is also being accorded to the following ailments: osteoarthritis, rheumatoid arthritis, whole spine degeneration, cardiovascular diseases, diabetic gangrene and foot ulcers, stroke and paralysis, chronic fatigue syndrome, cancer, diabetic wounds, necrotizing soft tissue injection, thermal burns, crush injuries, acute traumatic ischemia, air or gas embolism, and many more. Tapping the amazing healing power of oxygen. Oxygen is the most abundant chemical element in the Earth's biosphere, and it is also an indispensable resource to most terrestrial life. The generation and maintenance of all our body processes are supported by 4 basic life support components: carbohydrates, water, proteins, and energy. Oxygen is actually the overriding key ingredient in all 4 of these life support components. 80% of all our metabolic energy production is created by oxygen. Scientists agree that oxygen plays a powerful and primary role in our overall health and well-being. A growing number of researchers are convinced that the best way to improve health is related to the optimum oxygenation of every cell. Being the essence for life, it makes sense that large concentrations of oxygen under pressure can promote accelerated healing anywhere in the body. Introducing Hyperbaric Oxygen Therapy (HBOT) at Oxymed. With the mission of promoting and furthering public health and longevity, Dr. Ayaz Akbar and his team decided to adopt yet another life-saving, non-invasive technique for the effective treatment of acute and chronic tissue damage of any cause, any duration, and any location. Called the HBOT, an abbreviation for Hyperbaric Oxygen Therapy, this technique has helped prevent thousands of limbs from being amputated by improving vascular and circulation health and removing dead, damaged, and infected tissue. Hyper means increased and baric relates to pressure. Hyperbaric oxygen therapy or HBOT thus refers to the intermittent treatment of the entire body with 100% oxygen at greater than normal atmospheric pressures. HBOT is of immense value as a life and limb-saving measure in several medical and surgical conditions. HBOT appears to be promising in autism-affected children, paralytic stroke rehabilitation, traumatic brain injury, etc. HBOT, in most cases, supplements conventional treatment and is not meant as an alternative therapy. History of hyperbaric oxygen therapy. The use of hyperbaric therapy dates back nearly 350 years. The first hyperbaric chamber was created in 1662. However, clinical use of hyperbaric oxygen therapy started in the mid-1800s. In the early 1930s, the military developed and tested hyperbaric oxygen specifically in the area of deep-sea diving and aeronautics. During the 1960s, studies began on a wide variety of indications for HBOT. While the technique has gained popularity in the developed countries, it is yet to find ground in the developing world. There are just 3 hospitals in India, including Oxymed, offering HBOT. HBOT at Oxymed. Oxymed Hospitals has established India's first HBOT center in collaboration with the USA. The Treatment and Research Center at Oxymed Hospitals takes pride in treating FDA-approved conditions and researches on the off-label conditions under the leadership of Dr. Ramanathan Muthaiya, MD. Medical and surgical FDA-approved conditions where HBOT is used. Crush injuries and other traumatic ischemias, injuries due to road, traffic and other accidents. Actinomycosis, cyanide poisoning, diabetic wounds and ulcers, diabetic foot, tissue damage, mucositis, cystitis, bone damage, osteoradionecrosis following radiation for cancer treatment, osteomyelitis, thermal burns, necrotizing soft tissue infections, carbon monoxide poisoning and smoke inhalation, gas gangrene and other forms of gangrene, air-gas embolism or bubbles of air in blood vessels, decompression sickness, a hazard of scuba diving, severe anemia, skin graft or skin flap at risk of tissue death. Oxymed's 24-hour helpline and advanced ICU. Since the last 15 years, Oxymed has been functioning as a daycare center, treating thousands of patients without surgery. Also known for meticulous maintenance of medical records, Oxymed has computerized patient data pertaining to their history and treatment accorded. Such data is invaluable. For example, if a patient were to develop discomfort or uneasiness during the night, he would have to go to the nearest hospital where he will be subjected to a battery of tests in order to determine the cause of his complaints before being admitted in the ICU. In order to serve our patients better, we are happy to inform that we have become a 24-hour center with the most advanced ICU where we use a 24-hour helpline card with computer coding to enable access to patient data anytime and from anywhere in case of an emergency. Once the attendants of the patients call our helpline, giving the patient's medical record number, the duty doctor in charge of the hospital the patient is being taken to will immediately be able to ascertain the patient's history before the patient even reaches the hospital. This means saving of precious time in starting treatment. It also saves money to the patient by avoiding the duplication of investigations. In general, in cardiac emergencies, hospitals admit the patient in the ICU to stabilize him. Once stabilized, complicated treatments such as angioplasty or bypass surgery are resorted to. Oxymed, on the other hand, has a fully equipped, state-of-the-art ICU that can not only stabilize the patient but also subject him to highly advanced, non-invasive treatment and discharge him sooner than hospitals offering conventional treatments and surgeries. Offering advanced technology at affordable rates, Oxymed pursues research with unparalleled zeal. It also contributes to stronger public health by providing life-saving tools and information to save and improve lives, thus partnering with the government in building a healthy nation. Oxymed Hospital, Nandanam, Chennai.
Oxymed Hospitals, close to your heart.